live. Oh wait, hold on. Alright, now you're live.
Hope everyone had a nice Thanksgiving. This is Dr. Jamie Koufman with the Reflux Hour. I am writing a blog now, which is actually essentially a white paper. A white paper normally is when a bunch of experts get together and tell you what they think the state of the art is. In this case, it's my white paper. It's everything I know pretty much about the vagus, which is certainly not everything. I'm a pioneer. If you go to a neurologist and say, I have problems with my vagus, they're not going to know too much. So this blog is going to be spread over three blogs. The first one is already up. The second one is going to be up probably tomorrow. I may hold it to the beginning of the week, but it's about voice problems that are related to the vagus, and I'm going to talk about those today. And it's about neurogenic pain syndromes that are related to the vagus. Brenda, I'm getting a key frame rate too low. I don't know how to correct that. Too low FPS. Am I coming through okay?
Yeah, you're coming through okay.
Yeah, I've never seen this message before. For those of you out there who had some problems last time, I am now plugged into an Ethernet, and so hopefully these sessions will go well. So without further ado, the vagus nerve. So when you go to medical school, in the first year you take gross anatomy. And one of the things that you spend a lot of time on are the cranial nerves. And cranial means they come out of the cranium. They actually come out of the skull. They actually come out of the brain, out of the skull. And the cranial nerves are what you'd expect. All the senses, hearing and vision and balance and taste and smell. The senses are all cranial nerves. And the 10th cranial nerve is called the vagus. And the vagus is the most important nerve in the body. If you cut both vagus nerves, you die. The vagus nerves run the digestive system, the respiratory system, and the cardiovascular system, and all the organs inside. So the 10th cranial nerve, vagus, comes from the root word vagabond or wanderer, is the second longest nerve in the body. I think the leg nerve, main leg nerve, is a little longer, but maybe not. But it basically supplies sensory fibers. So if you have a stomach ache or heartburn or feel like you've got a cough, that's sensory. And then it's got motor when you actually do the cough, or you open your mouth and say some words. That's the motor. So you have the sensory and the motor. And the third part of the vagus is called autonomic, and I always call that the automatic, if you will, nervous system. And for example, things like swallowing and digestion and regulating your blood pressure and your heart rate, those things are not things you think about. Interestingly, though, emotions and feelings all have an influence on the vagus. There's a lot of stuff on the internet now about doing exercises for vagal wellness and breathing exercises and voice exercises. And I don't put much merit in that, but it is true that one could make a good case that the vagus is the seat of the soul. So you've got these nerves that come out of the brain. They run in the neck, right behind where the tonsils are or were, right under the lining, and they give the vocal cords and the cough. A big bunch of them goes to the respiratory and digestive tract, upper respiratory. Then another bunch, whole, if you will, almost looks like filaments take care of the GI tract, and then you see it almost looks like a river delta at the bottom, and this covers your internal organs. So I mean, we don't know if you have a vagal neuropathy if that has any effect on liver function or gallbladder or spleen. It's just not known. But I will tell you that vagal neuropathies are very common, and I'm going to talk about neuropathy in a minute. But I want to finish describing the vagus. So the vagus is motor and sensory and autonomic for the respiratory system, the digestive system, and for the cardiovascular system. So that's pretty much the nerve. It's the goat. It's the greatest of all time nerves. The goat is the vagus. Vagus is the goat. The vagus nerve can get injured, and when it gets injured, we say neuropathy is the consequence. Nerve sick, or nerve pathy. Something pathological has happened. So vagal neuropathies came to me because I started. You know me as a sort of a reflux guru, but I'm a laryngologist. I had the fourth laser in the United States. I trained to take care of laryngeal and voice disorders. I was a vocal cord reconstructive surgeon. So I started out taking care of patients with voice disorders. And I recognized early on that a lot of these people had reflux, and it wasn't much known about laryngopharyngeal reflux or respiratory reflux. And there wasn't much known about partial paralysis of the vocal cords. I pioneered the operation or one of the pioneers for fixing vocal cord paralysis, repositioning, so-called medialization laryngoplasty. And so I saw a lot of paralysis patients to operate on them and try to fix the voice. But then I began to see people had partial paralysis, and the partial paralysis patients had symptoms. And the symptoms were change in voice, effortful speaking, vocal fatigue. As you use the voice, it gets worse as time goes on, and finally voice use pain or discomfort. So you get the change in voice, vocal fatigue, effortful speaking, and pain with voice use. And the more the pain with voice use thing got in the mix, it was clear there was a subset of people, say, with a paralysis that came in and had that, and that I fixed the vocal cord, and the voice was terrific, and they still had voice use pain. So I began to think maybe this is neurogenic. Now let's talk about the word neurogenic. It means nerve cause. The genesis of this is nerve cause. So if you have your leg blown off in war and subsequently have phantom foot pain, that's neurogenic. That means the wrong message is being sent to the brain. If you've got a neurogenic cough, and you cough when you talk on the phone, you talk when you go into air conditioning, you talk, you cough when you chuckle or laugh, those are neurogenic symptoms. Those aren't reflux-related symptoms. So the vagus nerve can take a hit several different ways. Now, the most obvious ways are, say, if you have a tumor, if you have a big tumor in your neck, and it invades the vagus nerve on that side is going to go out. Or if you have operation to clean out your carotid artery, and they pull too hard and the vagus nerve gets stretched too much, you can have it. So surgery and tumors anywhere along the tract of the vagus nerve can have an effect. That said, most vagal neuropathy falls into what people call idiopathic, and that's a fancy word for we don't know what causes it. And we're so sure that we don't know that we're going to give it a name. It's idiopathic. So idiopathic vagal problems, as it turns out, are not so much idiopathic. I've been asking people and listening to people, and a lot of people have upper respiratory infections, and then within a few days or weeks they start to develop symptoms. And those symptoms vary from person to person. But that said, I began doing laryngeal electromyography early on because I was doing Botox for spasmodic dysphonia, which is a central movement disorder. It's a dystonia, like writer's cramp and other dystonias. When you've seen some with facial movement, but a dystonia of the voice and isolated is called spasmodic dysphonia. So I had an EMG machine because we were using the EMG machine to find the right place to put in the Botox, because if you had spasmodic dysphonia and you put in the Botox, you got a really good voice in most cases for several months. And so this had to be repeated. But anyway, I had the EMG machine, so I began doing diagnostic testing. And it turns out the superior laryngeal nerve, which is one big branch, comes off really high, and it innervates two muscles that are easy to get at. The superior laryngeal nerve does the tensors here, right and left, and the recurrent laryngeal nerve. So I could test pretty well the vagus, at least at this level, when I put those needles in and measured the electrical activity. So I began to look at patients who had voice symptoms. And as you know, I began to think about reflux about the same time. It didn't take long before these observations began to hit. So I started doing reflux testing with a probe, a good probe in the throat, probably around 83. And I started doing laryngeal electromyography around 87. I don't know exactly the year. And so what happened was patients would come to me, and I'd say, this patient looks like they have reflux, and we test them for reflux. And I'd say, this patient looks like they've got vocal fold paresis, with paresis being the word meaning partial paralysis. So that the vagal neuropathies occurred, the one thing you're going to see in most all these people, assuming it's occurred high, is vocal fold paresis. So the vocal fold paresis group constitute the biggest number of patients who've had vagal neuropathies that are symptomatic that I know. Okay, so I'm going to discuss several of them, but I want to first talk about vocal fold paresis. And so I'm going to tell you about a case. I think I have it here. A 40-year-old, I think I remember it well enough, a 40-year-old well-known actress came to see me, had an upper respiratory infection, and her voice was gone. It had been 3 weeks. She'd seen another doctor, put her on voice rest, and put her on some reflux medicine. But anyway, she came to see me, and she was really desperate because her voice was terrible. She had terrible voice use pain. Trying to use her voice really was terrible. She just couldn't function. She couldn't work. She wasn't working, but the bad news was that she was basically to start a film in California in 3 weeks. And in that film, she had to yell. So she not only had to have a good voice, she had to have a good voice with power. So I did the reflux testing, and her reflux was terrible. I put her on my program, and I did the laryngeal electromyography. And the laryngeal electromyography showed that all 4 of these laryngeal nerves had taken a hit, and that they were down, if you will, depending on which nerve you looked at, 25 to 50%. And she had a good prognosis for recovery. So low amplitude polyphasic units are so-called nascent units, like newborns. She had a lot of nascent units, even at 3 weeks. So I said, the prognosis for this isn't bad. Okay, and she had in fact, the vocal cords were not that bad looking, although they should come together completely like a hand clapping on a hinge, and I don't know how to do this. And she had a little gap, and she was pushing to get closure. So I said, okay, she's not my first rodeo, but what was different about her is I had to get her in good shape in 3 weeks. So she was on the strictest of all. She was eating at 4 o'clock in the afternoon, and she was sleeping almost sitting up, and she was on medicine, and she was on a special diet and all that. I have been treating neurogenic cough, and I figured out neurogenic cough a long time ago. And my book, The Chronic Cough Enigma, is being translated into so many different languages because it's the only book with content that covers neurogenic cough. So someone has a vagal neuropathy, and they develop a cough. And you're going to find that most of those people have reflux and neurogenic cough. And neurogenic means it's a dry cough. It happens all the time. It's not associated with reflux events. And that's the one they're talking on the phone, the changing of temperature. So neurogenic cough I had experience. And what I knew was there were two drugs that seemed to work the best. And one of them was called amitriptyline. And amitriptyline is an old-fashioned um, antidepressant called Elavil. But I didn't use that for that. I used a tiny amount. I only used 10 milligrams at night. And the reason I did that is I found that amitriptyline in combination with gabapentin, which is Neurontin, gave the best results with neurogenic cough. So I started this patient, this actress, on 10 milligrams of amitriptyline at night and 100 milligrams of gabapentin 4 times a day. It wasn't doing anything 4 days later, so I doubled it, 200 milligrams 4 times a day. And then every 4 days I increased it. So in 20 days she was on high dose. She was on the little bit of amitriptyline at night, and I had escalated it to 2,400 milligrams of gabapentin. Now you know there's a lot of variation in how a medicine works when a company makes 100, 300, 400, 600, and 800 milligram tablets. So in 3 weeks, when she was on her way to California, her voice was good and she had no symptoms. She still had some swelling, but she was functional and she had no pain, vocal fatigue, and she went off and did her film. She came back to New York in about 6 months. I think she was directing a TV show, and she was only on, we tapered her to 1,200 milligrams at night and didn't take it during the day, and then we escalated her off of that within the next few months. So this has never before been reported. The idea that vocal fatigue and effortful phonation, and so first of all, they're underdiagnosing vocal fold paresis. And I've put new material on this blog that's coming that's never been published before. So what it says is 90% of the patients who come to see me with voice disorders have reflux and or vocal fold paresis, and most of them have both. So that's what I've treated most of my career, reflux and vocal fold paresis. Now, I hesitate to do a talk on the vagus because I fear that everyone's going to start hearing these things and go, oh, that's me, that's me, that's me. And you should know that even though the vagus can cause a bunch of different problems, and I'm going to mention the other ones in passing, neurogenic cough has been well described, but the problem is that everyone doesn't have it. How do I know that? Well, years ago, I did a study of normals, and how I did that is in the next blog post. But anyway, to make a long story short, if you just go out into the population, the prevalence of vocal fold paresis is 40%. So 4 out of 10 people, I mean, that's almost 100 million people have vocal fold paresis. Most of them don't have any symptoms. I have vocal fold paresis, and although my voice isn't good and I can't sing, I don't have any symptoms. That ship sailed 20 years ago when we did have symptoms. So we know that it's common, and we know that people come in and they report, like this young woman, 40 is young to me, that she had an upper respiratory infection and that's when she crashed and burned. So we call that post-viral vagal neuropathy. So when you take all the cases of idiopathic, at least half of them have a story, post-viral vagal neuropathy, and then they have a pattern where when you measure the nerves, all 4 nerves that we test are affected, two from the right and 2 from the left vagus, which is just quite different. For example, if you had thyroid surgery, you'd just be out on the side that was operated on, and so on. So post-viral vagal neuropathy can injure the vagus, and it can cause vocal fold paresis, partial paralysis, and it's associated with these symptoms that can be made much better by treating neurogenic. Now, reflux makes neurogenic much worse. So if you've got neurogenic problem and reflux, you got to treat the reflux too. So we now have to talk about some of the other neurogenic problems. pain. So pain is not a throat pain. Chronic sore throat is not a common symptom of um, reflux. Reflux will make it worse, but when someone complains of burning throat pain, it's usually a neurogenic symptom, and you can do the laryngeal EMG and show, yep, this is consistent with the viral neuropathy, whether or not they remember having a virus. So I'm going to tell you a story. It's a great story. So this little tiny woman came to see me from Kansas City. I mean, she must have, if she weighed 90 pounds, I mean, she was not scrawny, she was just small. And she had terrible, disabling throat pain. And because of that, she'd had 3 operations. First, they took out her tonsils, made no difference. Then she had what's called a lingual thyroid. Then they took that off, made no difference. And then she had Eagle syndrome surgery. So first of all, I want to make a comment about Eagle syndrome. Eagle syndrome is what you call medical bullshit. So what happens is people have a chronic pain, and they say, ooh, it's because the hyoid is sticking into the pharynx, and they go in and they operate. So she had that too, and she still had pain. So to make a long story short with this woman, because it's really quite extraordinary, I escalated a dose over time. We did a lot of talking on the phone, and I saw her in July of whatever year this was, and I sent her home on 4,000 milligrams. She was taking 800 milligrams 5 times a day. And so anyway, she shows up in my office. She's in New York in the fall. She's happy as a clam at high tide. And she's got no pain. She's living a normal life. She didn't have any side effects from a gabapentin. And I said, well, how much are you taking? And she said, 8,000 milligrams. I said, what? I've never had anybody take anything like that. 4,000 is like the limit usually. She said, well, I kept going back to my family doctor saying, I'm convinced this neurogenic, give me more. And in 800 milligram increments, she got, so she was taking 1,600 to 2 800s 5 times a day. It was asymptomatic. So there is the most extreme example of chronic sore throat. So it's not related to an infection. It's not strep throat. It's not reflux. She didn't have any reflux, really. But she had a bad neurogenic problem. Of course, we did look at the nerves radiographically to make sure she didn't have a tumor or something else, which she did not. And she didn't have any other neurological symptoms, just pain. So we know that we got vocal fold paresis, which is the #1 biggest of all a neurogenic problem. And then we've got sore throat, which is not very common, but burning throat in particular is. Then we've got atypical chest pain. People have got shoulder pain, back pain. It goes through to the back. And this can be a vagal and in association with a vagal neuropathy. Atypical, I used to call it atypical heartburn, but it's pretty clear it's not just reflux related. Those aren't very common. And the question about function of the stomach is important. So I want to just mention before we get to closing. There's a diagnosis called gastroparesis. It means partial paralysis of the stomach. The stomach doesn't empty very well. Gastroparesis is definitely associated with vagal neuropathies. So here's another case. This nurse came to see me, a young man, and he was having attacks of nausea and vomiting. When it came, he was at the hospital with an IV getting a bunch of medicine, and he was usually home within 4 hours. So you get these attacks of nausea with vomiting. And he had a vagal neuropathy, and I treated him with a small dose, a relatively small dose for a man, 300 milligrams 4 times a day. And this took care of him, and I know because I followed him for a couple of years. So gastroparesis is on the list of neurogenic problems. And then you get to cardiac, and cardiac is sort of interesting because it's the rarest. I had a patient once that had reflux, and when the reflux occurred, suffered bradytachycardia. And so he ended up putting one of those heart monitor things in with the pH study and showed that when reflux events occurred, the bradytachycardia occurred. That's very unusual. If you have a tumor resting on one case I know of, a patient had a large cyst in the liver, and when they had a full meal, it would press on the vagus and they'd faint. They'd be in a restaurant, they always knew they had to lie down on the floor, they were going to faint. And of course, normal fainting is normal. I mean, if somebody, at my father's funeral, I fainted. And so that's called vasovagal, and it's relatively normal. So the vagus can cause pain, the vagus can cause cough, the vagus can cause fainting, the vagus can cause, as we know, voice problems. And and by the way, the vagus can cause reflux. In other words, someone gets a post-viral vagal neuropathy and they get voice problems and reflux problems because the vagus runs the whole show. So it's not unusual to have the onset of reflux following an upper respiratory infection in some people. So the vagus is so big that I worry that having given a talk like this, that it's going to basically make everybody go run to the doctor saying I have problems with my vagus. Well, you got three problems. First of all, nobody knows anything about it. I mean, I'm a pioneer and I don't know much. Although that said, I've seen 25,000 people with vagal neuropathies in my career, all with monitoring. So there aren't any doctors. You go to the ENT, they don't know. You go to the neurologist, they go vagus nerve, huh? And so that's the first thing. Second thing is nobody's doing diagnostic testing. Here's why. It has to do with Medicare and reimbursement. First of all, it's hard to do. It takes skill. Second of all, you got to buy the machine. It's expensive. Third of all, unless you're really good at it, it hurts the patient. And fourth of all, the reimbursement sucks. So nobody's doing diagnostic testing. I stopped. I'm in North Carolina, semi-retired. So there's a problem that we need, and I've been trying to prod my fellows and people that I've helped in the past. But diagnostic laryngeal electromyography, which is really a good test to look at vagal function, it just doesn't exist. So I bring this to your attention because a lot of you have neurogenic cough. If you have neurogenic cough, you don't cough when you bend over, you don't cough after meals, you don't wake up in the middle of the night coughing. It's a dry cough. In general, neurogenic cough is dry. Wet is reflux, and people who have both have reflux and neurogenic often. There are a lot of people who have neurogenic cough. There are a lot of people with vocal cord problems that aren't getting solved. Going to voice therapy and having a speech language pathologist work with you is fine for a few weeks, but doing it on a chronic basis doesn't seem to make much sense. So that's pretty much what I can provide for you all in a relatively short period of time about the vagus nerve. I did have a couple of questions that did come in that I thought were interesting, and in the couple of minutes that I have left, I'd like to address them. I was asked about a Schatzki's ring. A Schatzki's ring is a little narrow area in the esophagus. When it just looks like somebody drew a line and then put a little stuff on it, meaning the lumen is still pretty big size, nothing needs to be done about it. Just treat your reflux and it won't grow with time. On the other hand, if the Schatzki ring is very tight, it has to be dilated. In my experience, fewer than 5% of Schatzki's rings need to be treated. The reflux needs to be treated. The second question is, do they need to be recurrently dilated if they're tight? And again, this goes to the question of, is the reflux under control? Because the next question was, well, should I have the surgery? So people ask me all the time about laparoscopic fundoplication, and I'd like to make this my last one to try to answer today. If you have a life-threatening complication of reflux, airway obstruction, subglottic stenosis, recurrent little cancers of the vocal cords, and you're a non-smoker, idiopathic pulmonary fibrosis that maybe is not so idiopathic, I think you read my blog on bronchitis, a great story about a young guy who was coughing up blood for 2 years. He needed a fundoplication. And so I reserve fundoplication for people who have life-threatening complications of reflux and people who have done all the right things and just have a shot lower esophageal sphincter. And those are few and far between. So when you look at my practice, which was sort of the worst refluxers in the country, in the world, if you will, fewer than 5% of my patients ever have surgery. I recently wrote a blog on the lesser things like the Lynx procedure with the magnets, and all of those are not very good. So that does it for this time. When you go on, you can ask questions for next month, and I will decide upon the topic within the next couple of weeks. But sign up for the blog, tell your people, your friends about it if they have reflux, and look at this vagal blog. It's an important piece of work for me to put it on there. Anyway, thank you for your patience today. It's been the Vegas.